So, for today's video, I'm going to get a bit serious. As you may or may not know, it's Diabetes Awareness Month, all in the month of November. And I kind of wanted to, I guess, say a few words about it because it's actually really close to my heart and I have a very personal story about it. My dad has had type 1 diabetes since he was 6, so for over 50 years now. And it's something he has to live with every single day. When I get hungry, I go into the kitchen and I eat whatever I want and I don't really think too much about it. But when he gets hungry, he has to look at what his blood sugar is and whether he really needs anything to eat, and then calculate the carbs and make sure he has enough insulin to compensate for it. And it's a process. So he can't just eat whatever and not think too much about it. It's really a process. And it kind of just doesn't affect the person with diabetes. It kind of affects their family as well. He really tries to eat on a pretty regular schedule. So, as long as I can remember, we've eaten dinner early for my entire life, which is fine because, I'm used to it and I don't think too much about it. But, whenever we have to break that routine of what time we eat dinner, it takes a lot of planning ahead, and sometimes he has to eat a small meal beforehand, and it can be pretty challenging, which, if I'm gonna go out to dinner with friends and eat a little later than I normally do, it's not really a big deal. But for him, he really has to plan for it and, make sure that his blood sugar is gonna be okay and that he can make it to the actual dinner time. And as long as I can remember, if we're gonna go on a day trip, we have to make sure there's snacks and he has orange juice just to make sure that if something were to happen during the day and his blood sugar was to get too low, that he would be prepared to handle that. So you can't really do anything without really planning ahead. And it can be a hassle. It can be, I don't think he thinks too much about it now, but he still has to do it. It's always kind of in the back of your mind. And it kind of creates a lot of worry because if his blood sugar gets too low, it gets to the point where he can't take care of it himself. He really needs someone to come and, make sure he drinks orange juice and kind of get him back to where he needs to be. So if nobody's around, that's really scary. And what happens with a lot of people with diabetes is that they'll get low blood sugar in the middle of the night and, everybody's asleep, so nobody's really aware of it. And they can you can really do some harm to yourself if you go on too long without having fixing your blood sugar basically. Sometimes we'll hear him in the middle of the night and know something's not right, and we'll have to go wake him up. And when you're kind of in the diabetic low blood sugar range, you can start to be very uncooperative and not really know what's going on, and you're very confused. So he really does need help, and you need somebody else to kind of come and take care of it. So it makes you like, I just always worry about what if somebody's not there to help him when he needs it. And it's so scary. You know, I can't be there all the time to make sure everything's okay. And my dad takes such good care of himself, but these low blood sugars can kind of happen without warning. Just, the fluctuation of hormones and maybe if you gave himself too much insulin or things like that, it can really happen at any time. And the great thing is that the technology has gotten so advanced. You actually have insulin pumps now that will inject your insulin for you and kind of help you do the math, and they can even give you a rough estimate of what your blood sugar is so you don't have to test as much. And they really take a lot of the work and the guesswork out of it, which is fantastic. But it can't fix everything. And you get a lot of people just in public that are so rude about, oh, why do you have a beeper? Is that a cell phone? What is that? And you kind of have to explain to them that it's a medical device and what it does. And, people don't always know, even though I think to some extent more people know about what these things are now, but you still kind of get a lot of looks in public and it gets a little ridiculous for sure. And, with diabetics, they can have, especially if you don't take care of yourself, but even if you do, you can have problems with your eyes, you can get problems with your feet. A lot of diabetics end up having their feet amputated. There's just so many kind of, I guess, side effects to having diabetes that you would never consider that they could have. So I guess when I want to talk about Diabetes Awareness Month, It's not just that they have to check their blood sugar every day and watch what they eat, but, it's the families that kind of work around it every day, and it's the worrying, and to some extent, it's hard to be normal. And it's better now. When my dad first got diabetes, they really looked at it as though it were a mental illness, and obviously it's not. It's just kind of something internal. Um, but back then, he was made to feel so different, even though, other than that, there was nothing wrong with him. And, we've come so far, but I would do anything for him. And, I'm more than happy to do whatever it takes to keep him healthy. But more than anything, I just want a cure for him and for everybody else who experiences diabetes, because, it can kind of take a toll on your life and take a toll on your health in other ways. So, really, when I'm talking about diabetes awareness, it's just hoping for a cure, hoping that it can be better for somebody else, and that they won't experience those side effects, and they won't have to be so regimented in their healthcare routine, and they can go about their daily lives without worrying about it so much. And that's my hope for my dad and for everybody that experiences it.